What is colorectal cancer? Colorectal cancer, also known as colon cancer or rectal cancer, begins in the large intestine, colon, or the rectum, the final part of the colon. Most cases start as a benign, non-cancerous growth called a polyp, which can become cancerous over time. Early detection and removal of these polyps are key to preventing the disease. Symptoms. In its early stages, colorectal cancer often has no symptoms. However, as it progresses, a person may experience one or more of the following. A persistent change in bowel habits. This includes a new onset of diarrhea or constipation, or a change in the consistency of the stool that lasts for more than a few days. Blood in or on the stool. This can appear as bright red blood or dark tar-like stools. It's important to note that rectal bleeding can also be caused by other conditions like hemorrhoids, but any bleeding should be checked by a doctor. Abdominal discomfort. This can manifest as persistent cramps, gas, or pain in the abdomen that doesn't go away. A feeling that the bowel doesn't empty completely. Unexplained weight loss. Losing weight without making changes to diet or exercise. Fatigue or weakness. This is often a symptom of iron deficiency anemia, which can be caused by chronic hidden bleeding from the tumor. Diagnosis. If symptoms are present or as part of a routine screening, a doctor will perform various tests to check for colorectal cancer. These may include colonoscopy, considered the gold standard. This procedure involves a doctor inserting a thin, flexible tube with a camera on the end, a colonoscope, into the rectum to view the entire colon. This allows them to see and remove polyps or take tissue samples, biopsies, of any suspicious areas. Stool-based tests. These tests check for hidden, occult blood or abnormal DNA in the stool. A positive result from a stool test usually requires a follow-up colonoscopy. Examples include the fecal immunochemical test, FIT, and the multi-targeted stool DNA test, like Cologuard. Blood tests. While not used to diagnose cancer on their own, blood tests can check for anemia caused by bleeding from the tumor, or for certain substances called tumor markers, such as CEA, that can help monitor the disease after diagnosis. Imaging tests. If cancer is diagnosed, scans like CT scans or MRIs are used to determine if the cancer has spread to other parts of the body. This process is called staging. Treatment options. The treatment for colorectal cancer depends on its stage and location, as well as the patient's overall health. Common treatment approaches include surgery. This is the most common treatment for non-metastatic cancer. The surgeon removes the section of the colon or rectum containing the cancer and a margin of healthy tissue, along with nearby lymph nodes. In many cases, this can be done using minimally invasive techniques. Chemotherapy. Chemotherapy uses powerful drugs to kill cancer cells. It may be used after surgery, adjuvant therapy, to eliminate any remaining cancer cells and reduce the risk of recurrence. Or it can be used for more advanced stages to slow the cancer's growth. Radiation therapy. Radiation uses high-energy beams to kill cancer cells. It is most often used for rectal cancer, sometimes before surgery to shrink the tumor and make it easier to remove. Targeted therapy. These drugs are designed to target specific proteins and genes that help cancer cells grow and spread, while causing less harm to healthy cells. Immunotherapy. This treatment helps the body's own immune system fight the cancer. It is often used for cancers that have specific genetic features. Prevention. While some risk factors like age and genetics cannot be changed, a significant portion of colorectal cancer cases can be prevented through screening and lifestyle changes. Screening. Regular screening is the most effective way to prevent colorectal cancer. Screening tests can find and remove polyps before they turn into cancer. For average risk individuals, screening is generally recommended to begin at age 45. Healthy diet. A diet rich in fruits, vegetables, and whole grains, and low in red and processed meats, is associated with a lower risk. Physical activity. Regular exercise can help reduce the risk. Maintain a healthy weight. Obesity is a known risk factor. Avoid smoking and limit alcohol. Both smoking and heavy alcohol use increase the risk of colorectal cancer.